This next video is a recording of the information session that was delivered by Dr. Chris Morris at the Medical Education Forum on the 10th of November. Dr. Morris started off by answering some questions from the previous week. And one of the questions that arose was, what is the difference between power plans and favourites? So I'll run through the difference between the two now to answer the question. A power plan is persistent, which means that it remains in the patient's chart, so you can see a power plan always in the patient's chart. Whereas if you place an order for a favourite, medication, for example, once that order has finished, you will no longer see it in the chart as you will with a power plan. A power plan can have multiple orders for multiple days at one time. So you can use a power plan to set up future orders for your patient, and it also can have different phases of care. For example, you can set up pre-op, post-op care all at the one time on a power plan, which is a function that is only available in a power plan, and it can also be activated at a future time. The favourites is just a really easy way to put all of the orders together that you use commonly, just to make it quicker for you when you're selecting individual orders. So favourites will be individual orders, power plans are a group of orders. Then we introduce you to a care set, which is a new feature in the patient's chart, and it is a bit of a mix between the two. It does give you the ability to place multiple orders for the patient, and it does give you the opportunity to do, for example, patient care, medication orders, orders for consultations, but it is not persistent in that it does not remain in the patient's chart. So when the orders are used from a care set, the care set is no longer visible, whereas when the orders are used in a power plan, you can still see the power plan to take a look at that plan of care that you set for your patient. Power plans and care sets will be covered in more information in a future session by Dr. Morris, and also they will be heavily focused on within the training. Another question that arose from the previous week was, will an iodine allergy fire when ordering a CT with contrast? And the answer to that one was no. Please refer to the previous video where we looked quite in depth about allergies. Another question was, how many patient charts can be viewed at the one time? In our current state, the answer is 4, but as we move forward and move into the MARS release, we will only be able to have one patient's chart open at a time. The reason for that is purely for patient safety. By having more than one chart open at the one time increases the risk significantly of ordering medications onto the wrong chart and therefore having the wrong medications administered to the wrong patient. This session focused heavily on the current release, just some tips and tricks. It's been identified in training that there's certain great features of the current release in the patient's chart that are not being utilised because they're not known about very much. So this session is all about showing you a few little tricks that you can do in the current release, plus we talk about a few extra things too. So we'll be looking at using a doctor-patient list, we'll be looking at iPass, we'll be looking at how you can set your default view to a different screen, how you can modify your results tab views, and in terms of creating notes, we're going to look at how can you set default note types. We're going to talk about changing the title of your notes. We're going to look at more advanced auto text and how to insert an image into a document. We will also be showing you the tear off feature and focusing a little on the problem list too. When we go live, you'll see when we're prescribing, we'll now be using order sentences. There's 68,000 of them currently written into the patient's chart, with more being entered as well. An order sentence is basically the name of the medication plus the details that are attached to it. So if you wanted to describe 160 milligram tablet of diltiazem for your patient to be taken orally 3 times a day, rather than having to write out that entire sentence, you would actually just select the order sentence that has all of that information built into it. So it's got the most common doses and frequencies attached. Order sentences that you see will definitely be influenced by whether you're in an inpatient encounter or an outpatient encounter. Typically, an outpatient encounter, you won't see the IVs, for example, but the type of encounter will depend on what kind of results you see. There's the order entry field, which you'd be currently familiar with if you're currently placing electronic orders in the patient's chart, and that just holds the mandatory information. A lot of it is pre-filled in the order sentences because you've already selected that information. So it streamlines the ordering process and it just really eliminates the chance for errors. The system has got alerts built into it, so there's some smarts behind it that will do drug-drug interaction checking. So if you've got a charted medication and you try to order a medication that could potentially have an interaction, you'll get a drug-drug interaction warning fire on the screen. Same with drug allergy interactions. There is dose range checking, therapeutic duplication checking, there are renal alerts, anticoagulant alerts, and VTE prophylaxis alerts as well. Dr. Morris also talked about order sentences and timings, specifically talking about antibiotics, and that is something that we will take a look at as we go into the patient's chart now. The first thing we'll do is we'll go through the release 3, the current release information, starting off with the patient list. A lot of people are familiar with the patient list, and it's recommended that you do use your patient list to access your patient's charts, because by accessing your chart from this list here, you will always be opening the patient's chart to the current encounter. They only appear on this list because they are either checked into the outpatient encounter on your scheduling view, or they are admitted to the ward on your patient list. So these will always be the current encounters. Now this list here, you can right click and open a patient's chart, but what some people don't realize is that you can actually pull this information through into an interactive list. So I'll show you how we do that. We go up to Doctor Patient List and we click on Select a List. We pull through our patient list and we will be presented with an interactive list. This is a really helpful list if you're doing ward rounds. If you're an outpatient doctor, you also have the scheduling view as well. There are quick reference guides available, and also the digital trainers can assist you. So you will see either your scheduling view or your doctor patient list that we're looking at here is an interactive view. So let's say, for example, you're doing your ward rounds. You can open your patient's chart from here. You can add the diagnosis in from here, and you can also access what is called iPass. I'm going to demonstrate iPass to you now. This is in the current release, and a lot of people aren't familiar with this feature, but we're showing it in this session because it's a really, really great feature. So by clicking on this chevron next to your patient's name, we will see the iPass for the patient. iPass stands for Illness Severity, Patient Summary, Actions, Situational Awareness and Planning, and Synthesis by Receiver. You will also see here that there is a Clinical Data tab. By clicking on the Clinical Data tab, any medications that the patient has will appear on here as well. And when the pathology results pull through, the lab results will pull through here as well. This is a really, really fantastic tool for clinical handover. It's also really great for writing yourself quick little notes whilst you're doing your ward rounds. It's been identified that a problem is that doctors have not had the opportunity to finalise their documentation as they're doing the ward round. So they're going to documentation, they're starting a document, and they're writing their notes and reminders. And when they save that, it's actually being saved as clinical documentation in the patient's chart when it's not actually ready to be reviewed and treated as such. So think of iPass as your post-it notes or your little notepad to write notes to yourself, and also to communicate with other doctors. So just to give you a demonstration, we can mark that this patient is unstable, and straight away we see a color code here. The patient summary, so as you're doing your review, you could type your notes in here and save those. You can now go back to this at a later stage when you're ready to finalize your documentation. You can type your notes out, but this is a really great way of just saving quick little notes and reminders for yourself. Perhaps you want to order a full blood count later on or tomorrow, so you can make yourself an action here. So order FBC, for example. When you save that action, it now presents here with a little icon here where it can be ticked, and you may have noticed we've now got a little order icon here as well. So straight away, even just looking at our patient list, we're communicating information about our patient here. And of course, situational awareness and planning and synthesis by receiver. So you can write your notes and your information in here. As I said, it's also great for handover. The information that is in here does not interface into the patient's chart. This is the one place in the patient's chart where you can actually delete information and be sure that the information will not be in the patient's chart. So if you wanted to remove that note you'd written, for example, you can delete and save, and that information is gone. So to clarify, this is viewable to other medical officers. It is not available to nursing staff because nursing staff don't have iPass. I'm also going to show you how you can access iPass from the patient's chart. So for example, you don't use your doctor-patient list for whatever reason. We can go into the patient's chart. You'll be familiar with this alert from a previous information session. And iPass sits here. It's currently in the patient's chart, and you can click here and you can view that information in the patient's chart here. So depending on whether you're writing your notes whilst you're in the patient's chart or from your patient list, you'll be able to access iPass. Going back to my doctor-patient list, I'm just going to go through and add in a couple of illness severities, just so you can see the visual cues of the colours. And it gives a lot of information for your patient's chart, for your handover and your ward rounds. You can see straight away, and it does allow for prioritising. Okay, next thing I'm going to show you is when we are in our patient's chart, we are going to look at the default view. As you'll know, the doctor view is the default view. So when you open a patient's chart, the doctor view is the first screen that you'll see. It is possible to change that default to a different screen, and I'll demonstrate how you do that now. Perhaps you'd prefer to see the patient summary as your default screen. Simply right-click and set as default view. Now you've got your patient summary. So the vital signs, allergies, procedural histories, diagnostics, orders, and you'll see medications moving forward. All of that information is here. If you have set up a patient list, you can actually move through your patient list, and by using these arrows, it'll go to the next patient chart on your patient list. Again, we get the alert. And so now you'll see we're now looking at the next patient's chart. We don't have multiple charts open, and you can see it is open by default to the patient summary. Next, we'll look at the results tab views. Again, I'm going to show you how you can change the views from here. You can see on this particular chart, we are just seeing numerical information. However, you may notice on yours that you've got units, or you might have the auth verified information on here as well. So what I'll be showing you here is how you can change the defaults so that you see the information as you'd like to see it yourself. So to do that, we go up to options, and we are going to change our properties. Whilst we're here, I'll demonstrate that you can change your font size if you find the font size is too small. And we're going to go into the display tab. So as you can see here, we can tick to have the units of measure showing, the results status showing, or we can untick as well. And then save. Are you sure you want to save the properties? Yes, and OK. And now you'll see that the font size has increased as well. You do need to do this process on every tab, but once you've done it once, they're saved into your settings, and so you won't need to repeatedly do that. Next, I'm going to show you about creating notes. So I'm going to go into documentation here, and I'm going to show you how you can select your default note types. So when we go to add a note, and we click our drop down menu, we've got a lot of note types to scroll through there. You can set default note types, and that's what I'm going to show you now. You have to be in the documentation screen to do this. We go up to view, down to customize, and this is where you can select just the notes that you actually use. So maybe you use an admission note, maybe you use a progress note inpatient, and you can just select the relevant ones you want to see in your personal note type list. We'll click apply and we'll click OK. I'm going to refresh my screen. And now when I change my default to personal, my drop-down list only has the note types that I want. So let's say I'm going to do a progress note. You'll also see over here the templates can also be selected as favorites. So if you find that you currently mostly use admission notes, or maybe progress notes and a blank progress note, maybe an operation note, you'll see that they're all adding into favorites here. So it's just saving you time as you go into create your documentation. At the PA, we have a naming convention for our documentation, which is reason, team, role. So this is where we give a little bit more information, because if we leave our title as progress note blank, for example, if everyone who writes a note was to leave the title as progress note blank, it will be like having an email inbox full of emails with the same subject. So we just want to differentiate between who's writing the note and why. So the reason for this note is that it's a progress note, so we can leave that. The team is Ward 4E. And either your name or your position. So now that gives a little more information, so when you're scrolling through loads of documentation in the patient's chart, you can very quickly and easily see that. And if you use the contiguous note, which is changing to continuous docs, you'll be able to use that information for searching. The next thing Dr. Morris demonstrated was auto text. In the training for the current release, we showed how you could use AutoText to create your signature for yourself, to quickly put your signature in. But AutoText has a lot more potential than that. And it's really great for setting up templates specifically for yourself or for your unit. And now I'm going to demonstrate how you can do more advanced functions with AutoText. We click on the Manage AutoText icon. And I'm going to be creating new auto text to demonstrate. So this is all what we currently do. We put in our abbreviation. Let's say it's ward round 4E, for example. Description. And now we're going to add in the information by clicking Add Text. So maybe the first thing I want to do is have a heading of summary. And I'm going to click OK. You can continue to do that and add in all your different headings so that you've created a template, but you can also use these smart templates as well, which will pull information through from the patient's chart, and that's what I'll show you now. So for this demonstration, I'm going to be creating a ward round note, and I wanted to pull through my medication list as well. So by clicking on medication list, I'm now going to be pulling that through into the patient's note as well. Medication list is now appearing above summary, so I want summary to be moved back to the top, so I just move that up the list. I'm going to save and close. Now when I do my auto text, ward round 4E, you'll see I've got the summary here, which I can type into. And I've also got the medications list. It's pulled that information through from the patient's chart. That's just a little demonstration of using AutoText for advanced functionality. At the PA, we never save notes. We always sign and submit, because that is submitting it into the patient's chart as a finalized document. If you have forgotten to change your title, you get another opportunity here, and you can also forward from here as well. Okay, so now that's showing up in documentation. A lot of people did not know how to insert an image into a document, so that will be the next thing I'll be demonstrating for you. The thing that's a little bit different here is it can only be done from Clinical Notes view. There is a quick reference guide available on this if you do forget these steps. We go to Clinical Notes view and we create a new document from Clinical Notes view. So we select our document type, and as you can see here, it's pulled through my my favorites, and then we put in the subject. So medical imaging, reason team role, ward 4E, reg. So people are not too sure how to do this step, so I'm going to demonstrate how you do that. You find your image that you want to include, and you can either right click and copy the image, or you can use the snipping tool and you can just, which is on everybody's computer, and you can just snip the image that you require. So you can either copy and paste as you may be familiar with, or you can use the snipping tool. Going back to my patient's chart now. To paste the image in, it has to be Control V on your keyboard. You can't do a right click and paste. It has to be Control V. This will not save until you've got some text in the documentation. Most of the time you would be putting text in anyway to support the image. However, if you do just need the image, a simple full stop is enough for the system to realize that you've entered text, and then it will allow you to sign. Now you get the option to view the newly created document now. So we'll do that. And now we have got a report in the patient's chart with the medical image available in this particular example. You might find that you want to look at two sections of your screen at the same time, but you've only got one screen available to you. So you can use the tear off function, and that's what I'm going to demonstrate to you now. So if, for example, you're wanting to refer to results as you're creating documentation, you can click on the results screen here, and then you can go up to tear off. And it just pulls that section of the chart out of the chart, so you'll see results is no longer in here, and now it's available here for you. Then you can go into your documentation and you can refer to this section of your patient's chart and create your documents accordingly. When you reattach, you'll see that that will now go back into documentation here. There we go, into the chart, sorry. Next, I'm going to show you the problem list. So from Doctor View, I'm going to demonstrate the problems list because this has caused a few errors in the past. I'm going to now demonstrate that we use the problem list here for both diagnoses and also chronic conditions. You'll see that the default is set for this visit. So anything you enter in here will be added as a diagnosis if this visit is selected. You can change it to this visit and chronic for if it is a chronic condition and it's also the reason for this visit. You can select chronic if it's a chronic condition you're wanting to document, or you can do historical. Let's say chronic. So let's say the patient has hypertension. If we left it as this visit, it would show that the hypertension was the diagnosis for this visit. However, because we changed it to chronic, it's now showing up here in our problems list as a chronic condition. You can make changes to your problem list by going to Alerts and Problems in your menu. And you can refer to your problems at the bottom of the screen here. And you can edit these. If your patient, for example, no longer is a falls risk, you can actually modify that and you can deactivate that one. You can say it's resolved or cancelled, whatever the reason would be that you were cancelling that particular problem. If you accidentally entered in the hypertension as this visit, you would be able to right-click from your diagnosis and remove it and put it to the relevant section here. So that's just a little bit of an overview of the problem list. And the next thing that Dr. Morris talked about was order sentences and the alerts. I'm going to place a quick order for diltiazem. So here's our order sentences here, like we've talked about previously in the other video. And here's our mandatory field of the indication. So we need to communicate with other clinicians why we are ordering this medication for our patients. So we now have got diltiazem charted, and now I'm going to order quetiapine. The system knows that there's a potential drug-drug interaction between these two medications. And will alert me accordingly. So what I'm demonstrating here is the drug-drug interaction checking. You can see here that the decision support screen has come up, and it is showing us that there is a major reaction between quetiapine and diltiazem. The system will then give you the option to either remove the identified order, or you can override it. So the system is not going to stop you making any decision, it's just going to give you guidance. I'm going to remove that one because it was just for demonstration purposes, and I apologize that the screen doesn't fit into the capture size I've got here in the screen. Next, I'm going to show you drug allergy interaction. So I'm ordering benzyl penicillin for my patient, but they have got a documented penicillin allergy, and because that allergy was entered correctly into their chart, we can now see that we've had decision support for benzyl penicillin, letting us know that there is the potential for an allergic reaction. So in this case here, we'll say that we will remove identified order, and we'll replace it with an order that's more suitable for our patient. Next, we will do dose range checking. So I'm going to order doxycycline, and I'm going to modify the dose of that. I'm also going to order ceftriaxone as a replacement for my benzyl penicillin, but I'm still going to get the alert because it is still cross-referencing that medication with the allergy. But I'm going to override this one by choosing an override reason. So I'm going to go ahead and continue with that order. I might try and order diltiazem again, even though I already have it charted. And I'll get a therapeutic duplication alert now, warning me that there is already a charted order for diltiazem. And again, it'll give me the opportunity. I've got a therapeutic duplication. Here's the details of the order. Do I want to override that, or do I want to remove it? So I'll remove this order because it was a therapeutic duplication, and the system did a check. So I was able to see that a previous clinician had already placed an order for diltiazem. Now I'm going to go to the doxycycline, and I'm going to change the dose from 100 milligram to 500 milligram. When I sign for this order, we will see the dose range alert, the dose range checking. Before we sign, we're going to look at antibiotic timing, which is the final piece of information that Dr. Morris delivered at the session. You'll see here that ceftriaxone has got a red exclamation mark. So we can figure out really that that's alerting us to something. If you ever don't know what an icon is for, you can hover and you'll see information. And it's letting us know the schedule for this order needs to be reviewed. Let's click on the order and take a look at it. IV antibiotics always order by default with the first dose priority set as now. However, we chose a frequency of twice a day. So in the background, the system has the timing set in for twice a day as 8 AM and 8 PM. So if we place this order at 7 PM and the first dose priority has automatically defaulted to now, the next dose is going to be due in 1 hour. So that's when you need to review the schedule and amend accordingly if required. So we click on Review Schedule here, and we have the option to either change the time of the next administration, or you may like to skip that one completely, and then the twice a day will pick up on the next dose. We need to put in our indication, so we are communicating to other clinicians why this was ordered. And I'm going to sign. Now I'm getting this dose range alert. It's letting me know that a violation was found. The ordered dose of 500 milligram of doxycycline was over the suggested single dose range of 0 to 200 milligram. And again, it tells me that it's 500 milligrams for this order. Then we have the supporting information to explain why, where this guideline was extracted from. As I said, the system won't stop you from doing anything. It will just give you the opportunity to make the right decisions accordingly. So you can either cancel the order, you can either override the alert and continue with the dose that we put in of 500 milligram, or we can modify the order and change it back to a dose that is within range. I'm going to refresh my screen, and I'm going to finish off this video by quickly going to the MAR and having a quick look. We can see because the first dose priority for our ceftriaxone antibiotic was now, because it is IV, that is showing up in red. Please watch the next video that has been produced for Dr. Chris Morris's information sessions.